Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be.
I always love that music, and I always love to hear Debbie's voice. So good morning, good evening, good afternoon, everyone. My name is Marilyn Shannon, and this is the Health In Show. And each month we come together and we talk about all things homeopathy, health, natural healing, and anything under that umbrella. And it's always a pleasure to be here with my three dear friends, and we do this together. So there's Uta, there's Deepak, and Priti. Good morning or good evening. Hello.
Hello, everyone.
And
Hello.
Amnon is keeping this going, and every now and then you might even hear his voice.
Good morning.
So, good morning. So keep in mind, you are more than welcome to call in anytime you want and chat with us, ask questions. These three are brilliant. I'm the a little bit of a glue, but these three are brilliant. So you can call in 919-518-9773. You can chat with us in Skype and just do that with computers, and that's plural, the number 2K voice, computers 2K voice. And then you can also come into our chat and ask questions in there and comment and have fun. So have fun with us today. Let's make health a little more fun than it usually is. And this way it is. So Uta, you want to say a little bit about yourself?
Yeah, I can do. Hello, everyone. Today we want to talk a little bit general about HWC, about health, about homeopathy, about things that come up in what we do. I'm a homeopath. I studied homeopathy at the University of Central Lancashire in the UK. I've got a BSc and an MSc in homeopathy. And I came to join HWC, and I'm loving it. I'm loving the people that I'm working with, and it's an absolute fabulous organization. And we're going into a bright future, as I can tell, because these brilliant people have wonderful ideas, and we are working in very inspirational ways to create waves of awareness and pioneer ideas in homeopathy. I think I got the slogan a bit wrong, but I think you get the gist.
Oh, it sounded good to me. Good. And what about you, Priti?
So, well, I am Preeti Shah. I am a homeopath based out of India. I have done my bachelor's in homeopathy. It's a medical degree out here in India. I followed it up with a fellowship in homeopathic psychiatry and counseling. And I joined Homeopathic World Community with Marilyn, Deepak, and Uta just some time back, about a little more than a year now. And this community is just flourishing, growing with all the lovely people and all the lovely work that we're doing. Everything dedicated to homeopathy, to health, to wellness. Yeah, so it's an absolute pleasure to be here and to get to know all of you.
Thank you so much. And next is the man, Deepak. Tell everybody about you.
Thank you, Malin, and hello everyone. I am Dr. Deepak Sharma, postgraduate homeopath, also an assistant professor in Naminath Homeopathic Medical College in a department of pediatrics. So I am teaching to all my students in my OPDs also. I am a founder of Orbit Clinics, which is having 7 branches all over the world, and I am connected with the SWC since 2011. So it was the great time. I and Debbie Amnon, we three was started Health In Shows, and this is really great. And we miss Debbie, but we are here to spread the homeopathy through the smiles, through the SWC. And this is really a big organization, and I love SWC, and SWC is ours. So thank you, Marlene. Thank you so much. Please continue the show.
Thank you, Deepak and Pretty and Uta. So I guess what's the most important question do you think people want to know about homeopathy? I mean, our audience is made up of homeopaths, made up of people who are healers, made up of regular people who just want to be healed, want to stay healed, people who just love anything health. So what do you think is the most important question people ask of a homeopath? Who wants to go first? Anybody?
I have to think about it. What's the most important question?
Is there one question?
There isn't one question. I think if I'd have to formulate it a little bit differently, what makes homeopathy different? Homeopathy is a CAM practice. It is part of the complementary and alternative practices, but it's different to the other CAM practices in that it one of the main principles of homeopathy is ultra high dilution, and we work with energy medicine that is ultra highly diluted and succussed in the production process. That is, we very much dilute the substances that we would create remedies of beyond Avogadro's number, which means there is not a molecule of substance left in the remedy that we're creating. It's about the energy that is being transferred onto the carrier substance by succussing, by shaking the remedy at different stages of the production process. I think that is what makes homeopathy very different from most of the other CAM practices. We have a lot in common with many of the CAM practices. We have the nature of the interaction with our patients, the time we spend, the case history we take. We have a lot in common. We're a very gentle approach. Homeopathy is a very gentle approach. It's nothing invasive. It's not a hands-on therapy. So there are many differences, but some commonalities. But to answer just one question, and this question in particular, is a bit difficult. Or what do you think, Preeti?
So I think I would like to rephrase it this way. Let's say you have a plant in your house, yeah, or in your garden, and the leaves are drying up. What are you going to do with the leaves? Are you going to just paint them green? Is that going to be the solution? No, right? What the plant really needs is it needs good sunlight, it needs good nurturing, it needs nutrition in the soil, it needs the right amount of water. And all of that is going to make the plant healthy and alive. And I guess homeopathy is something that does the same thing. Like Uta was saying that our remedies are ultra diluted. Homeopathy is based on law of similars, where we whatever is unhealthy, whatever that needs healing, homeopathy is able to provide by providing a similar energy from the nature to heal you. So I believe homeopathy in a nutshell is gentle, it is safe, and it offers one of the very few methods that we have a more permanent solution to all our problems in a more holistic way. Does that make sense to you, Marilyn, Uta, Deepak?
Yeah, it adds another level. Go ahead. Yeah.
Marlene, this is really a good question. And the maximum people who are using homeopathy, they came first in homeopathy just because of they are not taking any care from any other treatments, like migraine. You can give an example of migraine. There is no treatment in any kind of other medicines or other system, but homeopathy works well in migraine. So there is a question about the homeopathy, how it is works. This is the biggest question all over the world. Always, everyone is asking about in India, in America, that how it works. So for this phenomena, we need to understand the actual understanding of Dr. Hahnemann, sir, who was the inventor of homeopathy. He was the German physician, but nobody knows that he was also a scientist. He was the first person who makes the mercury soluble. Nobody can the mercury soluble before the Dr. Hahnemann. So we are reading the medicine Merc solubilus Hahnemannii. So it means that Dr. Hahnemann was the first scientist who who makes the mercury soluble. So he's make the soluble in the ultra dilution. You already told Uta. So we need to understand the actual physiological phenomena of homeopathy, why how it works, and why it will be the better from the other system. The answer is, it is the only system all over the world which correlate your physical symptom to the mental state and then provide a medicine. There is no actually medicine you are going to treat the headache only, but we need to understand the psyche or the mental state of the patient with the physical journal. That is the beauty of homeopathy.
So when you say mental, do you also include the emotional?
Yes,
So it's the
definitely.
emotional, the mental.
I did not share the mental symptoms. I shared the mental state. That is the different way. Like for the example, there are a lot of medicines in the fever. In other system, there is a few medicines for the fever, but we have more than 300 medicine for the fever. So we need to identify the first mental state of the patient during the fever. He is irritable, or he is thirsty, or he is having the temperature on the different part of the organ, like the feet is cold and the hand is hot, like that. So mental state is the very peculiar thing of the homeopathy.
I guess the other question I have, which I think a lot of people question and want to understand more, and then feel free. I mean, we're just going to talk, right? So, why the energy of something? What is it? What is so potent about the energy, or why is the energy of something what you use as a remedy?
Well, you see, you have to look at it from a different aspect. During the times of Hahnemann, during his times, the medicines that were used by the so-called conventional medical system of his time was very frequently very invasive, and the plant or medicines, or the generally the medicines that were used, were often derived from poisonous substances, and a lot of people might have been cured of the disease, but actually succumbed to the effect of the side effects of the substances that were given in the process of wanting to cure the patient of a disease or an infliction. So the Hahnemann invented homeopathy mainly because he felt that there had to be something different, something less invasive, something less toxic to give to patients to help them to recovery. And so where this thought came from is very much from the fact that he began diluting these toxic and poisonous substances to an extent that they would not have the side effect of making the patient ill with another disease or actually killing them. So he diluted the substances and tried to derive in that process a form of using the positive aspects of the medicine to cure the patient, but reducing those that were negative or that were toxic to the patient. And in this process, or in this aim of finding, of deriving of a substance, the positive aspects, and deleting the negative aspects, he developed this system of diluting and ultra highly diluting the medicines. And he found in the process of doing this that something was retained in the carrier substance. I mean, you have to think of it like this. He came to the point where he diluted one drop of a substance. When we're talking of potencies, we have different potencies, that is different dilutions. And he would take one drop and would dilute it in vast amounts of a carrier substance. And this was a potent medicine by the process by which he was doing this. So something was left in that substance, even beyond the molecules of the substance being there. I mean, one very good example is actually, and I always mention that if somebody asks me how it works, it's actually nitroglycerin. Nitroglycerin in today's time in conventional medicine is a medication to lower blood pressure. Now, the effect is in conventional medicine that if you take nitroglycerin, it will indeed lower your heart rate and it will bring down your blood pressure. The side effect to that is that most patients actually get a headache. Now, in homeopathy, nitroglycerin is diluted even more. And what you get is the same effect of reducing the blood pressure, but patients don't necessarily get the headache. And of course, you have to look at it from this extent. I mean, nitroglycerin, one drop of that could explode. And with nitroglycerin, as you're giving it today in conventional medicine, is nowhere near as potent as making you explode when you take it. So actually, in the terms of nitroglycerin, conventional medicine is using the homeopathic principle of an ultra high dilution to make an effective medicine. What's omitted in this medicine is the succussion, the shaking of the substance at different stages of the production process. So actually, conventional medicine is using a part of homeopathy, for example, in the use of nitroglycerin as a heart medication.
Go ahead.
Simply put, Marilyn, I think we can say less is more. Yeah. So that's what homeopathy is all about, because as homeopaths, we don't look at disease in a very focused manner. In the sense, let's say like Deepak was saying, that somebody has a migraine, somebody has pain in the head. Is that person only suffering from pain in the head? Because most likely, along with this pain in the head, maybe he's not feeling well. He's agitated, or somebody's crying, or something else, or maybe he has loose motions. So, not a particular, it's impossible for a particular part to be diseased while the whole individual is not sick. So, the entire individual is sick. So mind and body are connected in that manner. Yeah, they are not two separate entities. If mind is not working well, if you're emotionally unwell, you are going to have some physical effects. And similarly, if you're physically not well, your mind is equally going to be affected. And to be able to work at both this mental, physical, emotional, endocrinologically level, you need an energy medicine which is able to touch all the spheres. And that is why the less. More is not really needed. Like you and me are connected right now. We are physically far apart, isn't it? But we are connected through this energy field. Yeah. So that's the principle.
Lovely
Malin,
example there.
there
Good.
is my point of view on energy. The homeopathic medicine are based on energy is just because scientists are not finding anything. This is invisible. So whenever scientists will search anything in homeopathic dilution, that will make another thing. Till then, they are calling the homeopathy is energy-based medicine. So there is no lacking in the homeopathy. This is a lacking of scientists who are not searching the molecule or the atom or the neutrons or the protons into our dilution. So this is their problems. But yes, still homeopathy is working very well for last 210 years, and this will work more than 2000 years. Same symptoms, same provings. And in the COVID-19, the vaccine is proved on the human beings, and the homeopathy is the only science which was proved only on the human beings. So there are the correct symptoms, there are the correct mental state, what I was told about you, these symptoms. So this is really a best part of the homeopathy, that it relate the physical symptoms to the mental state. So this is only the energy. Till then, they are not searching anything in the homeopathic dilution. So this is a problem of scientists, not homeopathy.
So now that you brought up COVID and the vaccination, I think it's a great entree into kind of discussing it and defining some of it, because if you're the masters, and you have taught me so much in a simple way, and I think it's the simplicity of how you teach that makes such a difference. So let's talk some about, because I've never, even before I even knew anything about homeopathy, I have never liked shooting anything into my body. It just never did. I didn't even know what I didn't like. I just did not like the thought of taking a flu shot or anything. Now, it doesn't mean it's not good for somebody. It's just not good for me. So what can you tell us about some of this? What are your feelings about these things? Who wants to go first?
Yeah, so in my perspective, whether it's flu or it's a flu because of COVID-19 or it's any other infectious disease, what is the most important thing? It's your immunity. It's how how your body is able to fight that external agent or an external pathogen or external virus or bacteria. So the most important thing to work with is your own immunity. The more, what do you say, the more empowered your immunity is, it can do its work, You don't really need external agents to do that for you. Yeah, you can take, an antipyretic if you have a fever, but the fever in turn is basically your body's own mechanism to deal with that infection, right? It is an indicator that your body internally, your white blood cells are fighting the germs. Yeah. So you could choose to take an antipyretic and suppress the fever, but you're not trusting your body's immunity to do the job. So I think the focus at this point in time should be how well you are able to boost your immunity, take care of your body and mind. If that's in place, I don't think we need to panic so much about anything else. And homeopathy can very well help support individuals to boost this immunity.
So I believe that COVID exists. Now, I know some people may not. I definitely believe it exists. And I know a couple of you, right? And I would say somebody here has had it, right? Did you have it, Pretty? Did you have COVID?
I have treated several patients having COVID,
Okay.
and I had a very close family member whom I was nursing who was suffering with COVID-19. And most of these individuals, recovered very well with homeopathy. Yeah. Only a handful of them needed, support of the conventional medicine, and especially life support, for which they needed to be hospitalized. But even in those handful of patients also, they recovered completely because they were additionally supported with homeopathy. So yes, there is definitely this COVID-19 virus, and I've seen a lot of individuals who've gone through the symptoms and had suffered from it. Yeah.
I guess one of the questions I have, and you don't need to wait for me to ask, but I'm asking as if I'm the audience. So everybody out in the audience, please feel free. You can call in, you can chat with us, you can do whatever you like. I'm asking questions like I'm you, because I am you. So, but please feel free. You know, you're more than welcome, and everybody here is just wonderful, and they're happy to answer them. Is it ever too late to build your immune system for something like this? Anybody? Is it ever too late to start to work on your immune system?
I think it's never too late for anything. You should always do something, and we underestimate our construct that is called the body very frequently. So any support in any illness that you may have contracted or you may get in the future, it's always there's always time, and there is never the right time. You have to try and keep a constantly healthy existence. If you lead a constantly healthy existence, you're likely your immune system is in a very good state and has a very strong you have a very strong system. So it's never too late to support your system. It is high time to do it when you've become ill, but you won't become ill if you keep your immune system, well, in good shape.
Deepak?
Yes, Malin, actually the improvement in the immune system doesn't mean that you are running very fast for 1 hour or 2 hours. You are sleeping for more than 8 hours. You are eating many fruits and many vegetables. This is not actually a one-day process. The first step is think happy. If you are happy with your weight, your immune system is good. You are happy with your food, you are eating very happy, then your immune system is very good. If you are a fearless person, then your immune system is really good. So it doesn't mean that you need to do many things for the immune to improve the immune system. Like in COVID-19, many of the person here in India taking the a lot of cinnamon powder, and lot of dry fruits are there, lot of kada mixtures of the Ayurvedic medicines. Instead of this, they are not improving in their immune system. They are getting worse in the stomach difficulties. They are going to bad stomach. They are having abdominal pain. They are having headaches. So we also treated this type of patient during the lockdown, who is having much fear for the COVID-19. And really, I seen the effects of our aconite within the seconds. The person was calmed down within seconds with a single dose of aconite. So immune system is another thing. First, you just think happy, be happy, and if you are thinking good, your immune system is always good. That is my point on immune system.
Yes, it's
But
like may I?
no, yeah, go ahead.
This COVID has created a second illness, if you like. It has created this illness that is called fear. And everybody is, or a lot of people, I see that too. I very much second to what you just said, Deepak. A lot of people have such a fear of contracting COVID. They might never get in touch with anybody or that has COVID actively, but they are so fearful that they are living their life in a constant state of anxiety, that they're not leaving the house because they're fearful, that they're okay, we're also not told to leave the house because the governments have inflicted such measures upon us. But of course, the anxiety that you create inside yourself makes you ill. As Dr. Deepak just said, it's the secondary illness to this COVID. And sometimes relieving of that secondary illness already is a lot. That can actually boost your immune system, because by being so very fearful, your immune system gets weakened. So remove the fear, be mindful in what you do out there, and not everybody will contract COVID, and you will likely not necessarily meet someone who's got COVID. And even if you meet someone who's got COVID, it doesn't mean necessarily that you will catch COVID. And if you catch COVID, it doesn't mean that you will necessarily get the COVID that will be so very bad that you have to actually go to a hospital or that you have to be in an ICU. Some symptoms are really very mild, and some patients recover within a very short while, absolutely completely without any after effects or anything. I think that's very important to say today. The fearfulness of this COVID that is being nurtured by our media. And of course, we're in our times today constantly connected via our little machines in our pockets, via the television and the internet. We're always confronted with horror stories and with what's going on. I think it's time to sometimes shut all this out and keep the TV off and not go into the internet, to not go crazy with all that's going on. It's a very take a mindful approach, I would like to say, to not get over excited, not anxious about the whole situation.
So should you be
And Malin, just a minute.
so should
And
you be
for
cautious?
the,
Go ahead. Yeah.
Malin, just a minute. And for this fear, homeopathy is the best, because in the four words of fear, we have more than 1200 medicines. So homeopathy can explain or treat what kind of fear can cause, what kind of disease can cause by the fear. So we have multiple medicines on the different phases. So homeopathy is the best for fear also.
So let me ask you something. Are you like I'm being cautious. I think I mean, I don't want COVID. I mean, I just don't want it.
Mhm.
I don't want to get near it. I don't want to risk it. I am cautious. So I'm not scared. I'm just cautious. In being cautious, I'm wearing a mask. Is that now I hear mixed stories of that. I hear some people say that it's, you're breathing out, you're breathing in your same stuff, whatever. What do you all think of that? Again, I'm being cautious. I'm not wearing it in fear.
Mhm.
I'm wearing it in caution. So of course, I think based on what I know from you and what I know in general, if I'm wearing it in fear, that's going to be one thing, the effect of wearing the mask. If I'm wearing it in caution, maybe it's a different effect. So what do you think?
There's nothing wrong with wearing the mask. I want to break a leg for the mask here. There's two sides to this coin. On the one thing, science has told us that the virus is smaller than the masks are in their construction, in the way they've been made. So a lot of scientific studies have shown that this is not necessarily useful in preventing anybody from catching the virus. The other thing is, what's wrong with wearing a mask? I mean, you're not harming anybody, and if you want to be cautious and if you feel safe wearing the mask, wear the mask. Well, fact is one thing, if you wear a mask, there is less aerosols coming out of your mouth when you speak. When you're coughing, you're not spreading too much out towards other people. Fine, wear the mask. There's nothing wrong with wearing a mask. If you feel safe wearing a mask, wear a mask. We are now asked globally, almost in every country, to wear a mask. A lot of people are now in a lot of conflict about wearing this mask. I don't think there's a problem with wearing the mask. I wear it when I go out. It's caution, it's respect towards others. Others are fearful if they see me without a mask. I've seen the other day, I always wear my mask, and I still went into an elevator and someone had gone in before me. He turned around and he saw me and he immediately went back out of the elevator. So that person was obviously very fearful, although we were both wearing a mask. I respect that. I think that's my stance to the mask. I don't know, Pretty, do you have a different opinion?
I think there is, in our times, suddenly there is so much polarization. It's like, you have to choose this or you have to choose that, and you can't be anywhere in middle, or you can't have different opinions. Or I think it has its own merits, and it also depends on the situation, country, and place you are in. I mean, where I live, we are extremely crowded. So the masks really help, and it is respect. It's respect for others. It's respect for yourself, and so there is no right or wrong. See where you are, see how you feel, and you take the necessary precautions. And I think being mindful and respectful to everybody around us and taking a moderate stand to everything is in the benefit of all. Yeah, let's not be too extreme about this. Yeah, so don't feel that you're wearing a mask, you're doing something wrong, or you're not wearing a mask, you're doing something wrong. So there is no one size fit all over here.
Yeah. Deepak?
Yes, the wearing the mask is actually a different story. Many countries are having the mask in the during the seasonal flu, because it doesn't mean that wearing the mask you are saving yourself only, you are saving the others also from your infections. That is the main thing. So but and there is a lacking in the wearing the mask, because many of the person are not knowing how to wear mask. That is really a big thing. So this is really important to learn about how to wearing the mask, the first one. And when you are living in a good environment means your mental environment, there will be nothing. Yes, virus exists, bacteria exist, all other parasites are exist, many things are exist. So there is not to worry, because this is not the first virus. The scientists who search is the first one, they named it the COVID-19. It doesn't mean that this is newly made virus from the scientists, because they are not the easy process to make a virus or the bacteria. So you need to learn about your positive energy first, and your to keep calm your mental environment, to cool yourself. So wearing mask is really different. Yes, I agree with the Preeti. You does not feel anything wrong with the mask. If you need to wearing mask, you just take a mask, or if you are not needing the mask, no need. But here in India or in the other country, the mask wearing is depending on the challans. How much the government fix the challan for the mask. So here in India, there is a different thing.
Yeah, it's mandatory. You get fined if you're not wearing a mask in public places. And which is for the benefit of the larger population. So you need to respect that.
Yes, you need to save
Absolutely.
others. You need to
Yeah,
save others by wearing mask.
absolutely.
Interesting, because it is an interesting conversation, because listening to the three of you speak about I mean, I always like hearing what you all have to say, because I think, okay, if they say it, it's good. Anybody else just feel free. Anybody else have anything to question, ask, comment, anything on your minds that you want to throw out there? Have at it. Anything?
So Marilyn, do you want to talk a little bit about homeopathic world community and what we do?
Sure. Go ahead.
I was hoping to hear from you, actually.
Start. Go ahead.
So we've been talking a lot about health, and we went into COVID-19 and masks and everything around it. And these conversations are important; they are necessary, and there also is a need for a safe platform to discuss this, where people, uh, you know, are not mean, or they don't take a prejudice on you, and this safe environment to make simple conversations, to ask silly questions, to get opinions from peers and people from different backgrounds around the world. I think that is the soul of HWC, isn't it? To be able to connect all of these different people from all these different backgrounds and coming together, respecting each other and sharing. So for me, that I think is the essence of what we do and what we are.
And let me just add that, and you don't have to be a homeopath. We're made up of homeopaths and just people interested in health. Who want to learn from homeopaths. Homeopaths want to learn from homeopaths. Naturopaths wanting to learn from homeopaths. Homeopaths wanting to learn from naturopaths. We even have coming up a course on astrology. Now that we do those kinds of things because we know that there's a root at root or core of our health, and we want to understand as much about those roots and cores and souls of health as we can. So it could take us into all kinds of directions. And again, just like Pretty said, and there's no there's an openness. So that's we're a community, a social networking community at that as well, where we discuss health. So anybody else?
Yeah, we've got groups where people can join into discussions. So there's groups that are for the public where you can ask questions if you've got concerns and you'd like to hear what homeopaths or other peers have to say, as Pretty very well said. There are professional groups, of course, where professionals, practitioners discuss topics of interest. We have a wonderful webinar coming up for the homeopaths that might be listening with Ton Jansen, who devised the human chemistry method. We've got one of those coming up. For homeopathic practitioners in February, we are starting a practitioner supervision group discussion. We'll have an event once a month or once every other month where homeopaths can discuss with other homeopaths about issues that arise in their practice, in their treatment with or their interaction with patients, in the treating space, and the consultations. Not issues pertaining to finding a remedy or treating a case, but concerns that they may have, how they think they could improve their practice or where they are struggling with certain aspects of their practice. So that's something that's coming up for practitioners in February. We're also going to start, or we already had one session, we're going to have the second session of a spiritual wellness circle where we get together from different spiritual backgrounds and we talk. This time we're going to talk about love. It's actually on the 14th of February, I've seen earlier on. So what other topic to talk about? We're going to talk about love and the relationship to the self. Those are all aspects that make up so much of our lives. And we want to discuss it and we want to take ourselves away from religion, but to actually speak about the spiritual aspects. And we have wonderful conversations coming in together from these different backgrounds, and each of us sharing and discussing and talking. It's a very supportive and very loving space, and we do loads of such things. These are just two of things that are coming up in February, but we have a lot more planned and a lot more in store. So do take a look at our website. We have a calendar on our website, homeopathyworldcommunity.com. And in the calendar, you will see what's coming up in this month and then in the following months as well.
And we do art because, when you think about it, and based on what Deepak said, what Pretty said, what Uta said early on, how you feel can be and is a direct relationship to how you feel. So if as we get into more issues about love, and we talk about love, we talk about spirituality, we express ourselves creatively. Can you only imagine the position you put your immune system in when you talk about love? and you talk about creativity, and you do things creative, and you read a book that you like, and you surround yourself with people who are loving and gentle, and as Deepak said, have with his calm voice, right? Isn't that lovely? So Deepak, you're smiling. You must have a really good immune system.
Thank you. Thank you. Because I have no anger, no fear, no jealousy, I never criticize anyone. So this is just about my immunity, and I feel with all SWC members like Uta, Malin, you, Preeti, you all have the good immunity. So this is actually the quality of SWC.
That's very true, isn't it?
Very nicely put. Yes.
Yeah, very nicely put. And as a man, you know, as a man, to not experience anger, to not be judgmental. And I'm not trying, and I don't want to be judgmental and say men are this way and women are this way. But typically, you know, from my observations, men don't always have the permission not to be angry and to be a certain way. And so you're a really great role model, not just for women, but in particularly for men.
Malin, you want to listen? I want to talk about the anger of every person. I want to be anger like the pulsilla. That is the wonderful remedy of homeopathic medicine. This the pulsilla is the very calm medicine, but her anger is really good. This is always manipulative. Her anger is always to do good for the society. So I doesn't mean that I never anger, but whenever I anger, it means something. It means to the society for the positivity, and I learned many things from the angers of my patients. Whenever you see the most of the patients are coming with the too much anger, you just keep calm yourself. So that is actually the quality of homeopathy. I am calm just because of homeopathy, because I learned so much from the homeopathy. So we are talking about the homeopathy today and the qualities of homeopathy. So whenever you learn the homeopathy, you just keep calm with the learning of homeopathy.
So joining HWC is helps you surround yourself with that, and it helps you surround yourself with, you know, it's one. And I've gotten to work with homeopaths, and my friend Debbie was it. But since I'm working with homeopaths like Uta and Deepak and Pretty and a whole bunch more that are on our board, I am amazed as somewhat of an outsider. I am so amazed at how caring and and we grow so much from where we are. It's been amazing to me. And I, in particular, love to share this with all of you out there, because it's like a secret, and it shouldn't be. It should be the truth, not a secret. So it's really, I mean, we welcome you to come, and we welcome you to be part of, whether you want to just put, one little toe in the water, or you want to jump in full body. Just come in. You're not alone. There's tons of things to learn and experience, explore, create on your own, be a part of, just like this show. I mean, we just, we want to make a difference in the world and share that difference, whatever humanly possible we can do. So who else has any comments or thoughts or anything you want to add to that? Money. And everybody out there, we're not too late. You can call us at 919-518-9773, or you can join us in the chat and just put your name underneath the video that you see with my picture there and ask questions. And also you can come in on Skype, and that would be computers, and that's plural, then the number 2K voice.
You can also find us on Facebook. If you take a look at what we're doing on Facebook at Homeopathy World Community. We've built our following there. For practitioners, we have a discussion group on there. We're out there, so if you have any questions, reach out to us. Join us on our website, homeopathyworldcommunity.com. We're a resource of a lot of information on there. Our practitioners are publishing their articles with us. We have a lot of data on there and a lot of courses and programs coming up. So take a look at the website and see if there's something on there for you. I'm sure you'll find something for you.
And you know, I've said this a lot lately in other ways, but it's really healthy to connect. I mean, it's a time when you want to, I am hoping and I'm assuming you want to be part of a community of people that you can ask questions to regardless. You can become part of no matter what. You can explore whatever. I mean, there's so much opportunity, and, we'd love to have you all a part of our where we are now and where we intend to go. And we only are going where we all want to go, and we're exploring all of those options. So, it's a really good time to feel a part of something good. And this is good. So, we have these groups on Facebook, yes, and anybody can participate. We're on Instagram. If you think we should be somewhere else, let us know. We only know what we know too, and together we know a lot. So, Pretty, what's in store for you for 2021?
Can I just say something before I just want to interject here, because before I forget, if you just want to find out what we're all about, why don't you join us for one of our virtual coffees? Because we run, not every month, every other month, we run a virtual coffee where we meet up on Zoom. It's homeopaths and non-homeopaths, and we just chat and laugh, and it's always such a fun time. We answer all your questions, we discuss, we talk about God and the world and everything on it. So it's a very free and open space. We're non-judgmental, we're supportive, and we love everything we're doing. So do come and join us. We will announce it, as I said earlier on our calendar. So the virtual HWC virtual coffees. So if you're interested to get to know us, come and join us in one of those. Sorry, Pretty, go on.
No, so I was saying, in similar lines to what you were mentioning, I think in some way or other, 2020 has kind of made a little transition in the way we are leading our lives, isn't it? We are doing so many things now virtually, and there is a lot of good in it, right? I mean, so many times we thought homeschooling was impossible. But now it is possible, isn't it? Sitting here in a small, I could be on some mountain, in a very remote place. And if only I have an internet, I'm able to connect to everybody out there in the world. So 2021 for Homeopathic World Community on the same lines is going to be, I don't know, do you know about the banyan tree? Have you heard of this tree? I don't know if the English name is also banyan, but let me look it up. Okay, so basically, it's a huge tree. It's the ficus family, if I'm pronouncing it right. It's a very huge tree, and the roots are also, hanging. Okay, and the roots are so deep, it goes around in acres and acres. So our foundation and our roots are going to be so deep like the banyan tree, and we're going to stand tall and connect and bring all these different elements, homeopathy, naturopathy, art, spirituality, meditation, yoga, you name it, and everything. Whatever it is that brings you joy, whatever it is that can bring healing in a very gentle way, we're going to bring all of those together and strengthen our foundation and expand, and then sky is just the limit, isn't it?
Yeah, I love that. That's a good picture. Good. Deepak, anything else?
Yes, I want to say every student of homeopathy, although we all are a student, but who are learning in the beginning in the homeopathic word community is the best for you. So join us and see the learning part of the homeopathic word community by the articles and blogs already what Dr. Urta said. So I request all the students who are the beginners, please join.
And that is at homeopathyworldcommunity.com. And we're even beginning to listen to some really cool music too. So you'll have to join us and you'll have to see. So anything else in closing? We do this once a month. We'll be here next month again, the second Tuesday in the month, with another interesting show. A lot of times we have some guests. Sometimes it's us. Uta, anything?
Brilliant. It was loads of fun today. I think it's the first time I've been in a show where it was just us, not a speaker. We have loads of fun with our speakers too, but this was fun too. I very much enjoyed it. Thank you so much, all of you.
Yeah, thank you. Yeah, we have fun with each other. We have fun with our guests too. Well, I'm not anything in closing from you.
No, I mean, I think this was a very interesting show. I think this does for the little people a whole lot more than the shows with the speaker. With the speaker or with the guest, it's more for the homeopath. This was very good information for those who said, "What is homeopathy?" Which is a lot of people.
Right.
Yep.
Thank you. Well, you don't know what you don't know. And sometimes we're what they call a creature of habit, and it's hard to break those habits. So we want you to know that we want to help empower you to know that there are options. And this is the banyan tree, right?
That's right.
This is the banyan tree. For those of you who tuned in late and don't know what a banyan tree is, you're going to have to contact us and we'll tell you. But this is a banyan tree. All right. All right, everyone. Have a happy, healthy new year, and we will see you next month. Bye.
Thank you. Bye-bye.
Bye. Take
Bye,
care.
everyone.
Bye-bye.
Bye.
You are tuned to the Nissan Communications Network. If you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it in the archives section at nissancommunications.com. Don't forget to subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Sponsored by Telestream's Wirecast software, StreamingGear.com, Carolina Apparel, and DeltaForce.net.